Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. What's wrong with my stomach? If it feels like there is something wrong with your stomach, the cause could be digestive or it could originate somewhere else, such as your urinary tract. Digestive problems can cause a range of symptoms, from constipation or diarrhea to stomach upset and pain. /r/n/r/n Most digestive problems are temporary and will clear up on their own. But others are chronic. Some can even be serious and life-threatening. Understanding what different symptoms might mean can help you manage the problem and find a long-term solution. /r/n/r/n This article discusses a range of digestive and abdominal problems including those that affect the upper and lower gastrointestinal tract. It explains the symptoms of common ailments and signs that you should see a healthcare provider. /r/n/r/n The digestive system consists of the gastrointestinal, GI, tract as well as the liver, pancreas, and gallbladder. The GI tract itself is made up of several parts. Healthcare providers usually refer to one section as the upper GI tract and the other as the lower GI tract. /r/n/r/n The mouth, esophagus, stomach, and first part of the small intestine, duodenum, comprise the upper GI tract. If you have problems with the upper GI tract, you may have symptoms such as heartburn, problems swallowing or passing food along your esophagus and stomach pain, nausea, and vomiting. /r/n/r/n Gastroesophageal reflux disease, GERD, is the main cause of heartburn, a burning sensation in the upper abdomen that usually occurs after you eat. When the muscles between the esophagus and stomach aren't working right, the contents of your stomach, including acid and food, go back up the esophagus. This is commonly called reflux. /r/n/r/n A peptic ulcer occurs when acid or digestive enzymes eat away at the lining of the stomach or duodenum. Symptoms can include pain, bleeding, and blockages in the digestive system. Most peptic ulcers, whether in adults or children, are caused by a Helicobacter pylori, H. pylori, infection. /r/n/r/n Gastritis is an inflammation of the stomach lining that causes symptoms similar to heartburn. It's usually treated with medication to reduce stomach acid. /r/n/r/n Also referred to as delayed gastric emptying, gastroparesis is a disorder in which the stomach takes too long to empty its contents. It is usually caused by damage to the stomach nerves. If you have type 1 or type 2 diabetes, you're at an increased risk of gastroparesis. Medications can also cause gastroparesis. /r/n/r/n Gallstones can form in the gallbladder when bile hardens. If gallstones block the ducts of the gallbladder, they can cause severe pain. Some gallstones never cause symptoms while others need to be surgically removed. /r/n/r/n People who have celiac disease can't eat gluten since it causes an immune response that damages the small intestine. Celiac disease is often mistaken for other gastrointestinal disorders before it's correctly diagnosed. /r/n/r/n Your healthcare provider needs to run blood tests and other labs to determine if your symptoms are caused by celiac disease. /r/n/r/n Pain in the upper abdomen may not actually be caused by problems with the esophagus, stomach, or duodenum. Sometimes the pain originates from a problem elsewhere, such as a compressed nerve in the spine, which also irritates nerves in the abdominal wall. The same can happen with pain in the lower GI tract. Pain may radiate from a source outside the lower abdomen. /r/n/r/n The lower GI tract begins after the duodenum. It runs from the small intestines to the large intestines, or colon, to the anus. /r/n/r/n There are several digestive disorders that can contribute to intestinal symptoms such as lower abdominal pain, cramping, and bowel movement problems. /r/n/r/n Diverticulitis is the inflammation of the diverticula, which are bulging pouches in the walls of the intestines. Symptoms include sharp pains in the lower left abdomen, usually accompanied by a fever. If left untreated, diverticulitis can cause life-threatening complications. /r/n/r/n Inflammatory bowel disease is an umbrella term for two conditions, which can sometimes overlap, Crohn's disease and ulcerative colitis. Both are chronic conditions that require lifelong monitoring and treatment. /r/n/r/n Irritable bowel syndrome, IBS, is a very common digestive disorder that causes recurring abdominal pain, diarrhea, constipation, or both. /r/n/r/n Stomach cancer is the fourth most common type of cancer in men and the seventh most common cancer in women. Often, stomach cancer, also known as gastric cancer, doesn't have symptoms in its early stages, or the symptoms are similar to other stomach and GI disorders. However, there are some signs to watch for, especially if you have a family history of stomach cancer. /r/n/r/n These red flag symptoms include /r/n/r/n Other possible symptoms could include anemia, blood in your stool, and recurrent pain. /r/n/r/n Certain conditions that originate in other parts of the body, such as the urinary tract and female reproductive system, can cause symptoms that feel like they're coming from your stomach. /r/n/r/n A urinary tract infection is a bacterial infection of the bladder or other parts of the urinary tract, including the urethra and kidneys. Besides urinary symptoms like pain with urination and frequent urination, you may also experience /r/n/r/n A number of different conditions of the female reproductive system can cause problems that feel like they originate from the stomach or intestines. Some of these conditions and their associated symptoms include /r/n/r/n It's best to discuss any ongoing GI issues with a healthcare provider. Pain, bloating, constipation, and diarrhea affect everyone from time to time, but if these are a regular occurrence, you could have an underlying healed H condition. Importantly, anytime you have blood in your stool, you should see a healthcare provider as soon as possible. /r/n/r/n Treating GI issues doesn't just help relieve the immediate stomach or lower abdominal distress. Research shows the body's gastrointestinal system, also known as the gut, plays a large role in your overall health. /r/n/r/n Talk to your primary healthcare provider first. However, you may be referred to a gastroenterologist, a doctor who specializes in diseases and disorders of the digestive tract. /r/n/r/n Upper GI issues often cause heartburn and pain or discomfort in the stomach or chest. Problems with the lower GI tract can cause cramping, constipation, or diarrhea. Disorders of the urinary tract and female reproductive system can also cause symptoms that mimic GI conditions. /r/n/r/n Stomach cancer may cause symptoms similar to GI disorders. Look out for severe problems, such as bloody stool, which could be a sign of cancer or an emergency condition that requires immediate medical attention. /r/n/r/n rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.